sand along the Illinois River to supplement local flood prevention operations. National Weather Service projections had indicated massive potential flooding in the area. This work has likely saved many lives and prevented hardship for hundreds more. I want to take just a moment to say that our Illinois National Guard is second to none in the United States. Throughout the COVID-19 crisis, hundreds of Guard members have played a crucial role in protecting Illinoisans, including those right here in East St. Louis, where rain or shine, the Illinois National Guard is operating our Metro East state-run drive-through and walk-up community testing center right here on the property. And that's what we're here to celebrate and call attention to today. I'm joined here at the community center by Mayor Robert Eastern, by St. Clair County Board Chair Mark Kern, East Side Health District Public Administrator Elizabeth Patton Whiteside, Leader Jay Hoffman, Senator Christopher Belt, and Representative LaToya Greenwood. This testing center is one of 46 that we have across the region of Restore, Illinois. That includes our 27 federally qualified health centers. Each day, this drive-through site can receive up to 500 samples from anyone who needs a test. These are free for the public to access. Tests are available to any essential worker, like a grocery store clerk, a nurse, or a pharmacy worker, any first responder, anyone with COVID-19-like symptoms, anyone with a compromised immune system, or anyone with known contact with a COVID-19 positive case. We want testing to be as easy as possible for Illinoisans. You can find a testing site nearest you. If this isn't the closest one to you, you can find it online at coronavirus.illinois.gov. Again, coronavirus.illinois.gov. And speaking of testing, over the last 24 hours, out of 17,179 total tests, 1,111 came back positive. That's a single-day positivity rate of 6.47%. Remember that these are pure diagnostic tests. Illinois does not inflate our daily testing reports with antibody tests. That brings our statewide total of confirmed positive cases to 113,306, with over 800,000 tests run to date. The vast majority of those individuals who tested positive have already recovered or are experiencing a mild enough case that they're recovering at home. As for our statewide hospital numbers, as of midnight last night, we have 3,826 Illinoisans in the hospital with COVID-19. Of those, 1,031 are in the ICU and 592 are on a ventilator. I'm also saddened to report that we have lost another 160 Illinoisans in the battle against COVID-19, bringing our statewide total of lives lost to 5,083. These are real people whose lives came to an end because of this pandemic. They are grandparents and uncles and aunts and parents, cousins, children, friends. They had whole lives that were cut short because COVID-19 knows no boundaries and only seeks to destroy. We can never forget that. May the memories of those who were lost be for a blessing. For those watching at home in other parts of the state, East St. Louis is in St. Clair County, home to one of the pilot contact tracing initiatives the Illinois Department of Public Health has launched to help tackle a public health situation of this magnitude. In this work, I'm proud to announce that IDPH and St. Clair County Health Department will be joined by the East Side Health District here in East St. Louis, a trusted organization that has dedicated itself to community-based health services here in Metro East for over 70 years. It's exactly the kind of partnership that's going to help us reach and support more people, and I'm glad it will become one of our first two major contact tracing expansions. I'm proud today to be here with the leaders of that operation. For more on that, I'd like to turn it over to one of the greatest county chairs in Illinois, St. Clair County Chair Mark Kern. Mark?
Gonna have to remove my mask for that one. So to put this in perspective, because I think all the days seem to run together, on March 14th in St. Clair County, we had our first COVID positive diagnosis. March 16th, our governor came here to St. Clair County to talk about the state's plan and the executive order that he had put into effect the day before we actually had our first positive, limiting what was going on in the state and allowing people to stay safe and telling them how to do that, whether it was through washing your hands or the cleanliness part or telling people to stay home. And it was on that day that we launched our effort here in the county. Through that point, we've worked diligently with all of our mayors, our first responders, certainly with our state representatives, Hoffman, Greenwood, and Senator Chris Belt, all who have been an integral part of this effort to be able to get PPE. When we started out, we were seeking masks and hand sanitizer and hospital gowns. Those things were all in short supply. Their efforts through the governor's office made sure that not only all our first responders and our hospitals and our dentists and our doctors and our long-term care facilities had what they needed, but they made sure they had it in a timely fashion. IDOT trucks pulled up and are pulling up on a regular basis in front of our EMA office, delivering pallets of PPE to make sure that people are taken care of, the people that are out there fighting this fight for us to make sure they are safe. So we've now entered into, as the governor said, the tracing portion of this project. Testing has been ramped up. Initially, and Liz will verify, inside Health District area at Touche Hospital, when the governor came here at first, we had 14 tests at Touche Hospital, 14 tests for that hospital to be able to run their operation. Now tests are flowing, and just at this site alone, we have the opportunity to do 500 tests a day. That is a major accomplishment in a fairly short period of time. The tracing grant that comes here now will allow us to take people and talk to them if they're diagnosed COVID positive, have people to call them on the phone, ask if they're staying at home, ask who they were in contact with during the point which they were contagious, and be able to make this operation move into the next phase, which is containing COVID, if there are hot spots, to make sure they don't break out so that our county can go back to as close to normal as we possibly can. None of this would have been possible without the state of Illinois and the strong leadership of Governor Pritzker and the strong leadership of his people that are behind me, the state representatives, the state senators that understand St. Clair County and its people and work hard with it every day. Special thanks go out to Mayor Eastern, who's been a strong part of the team, Team St. Clair, as well as Liz Patton with Eastside Health District. Hand in hand, we've worked on this issue, and we appreciate everybody's support. Thank you. I have no X. At this time, I'd like to introduce the mayor of the City of Champions, Robert Eastern, mayor of East St. Louis.
Good afternoon. I'm very excited about being here. Thank you, Governor, for all the hard work you're doing, and I echo everything that Chairman Kern said. You know, this COVID-19 situation and pandemic has been very fluid. You know, that we couldn't have planned for this, you know, so we just executed kind of on the fly, and your execution was well, Governor, so I appreciate that for everything that you're doing for my city, our state, and our county. Yes, the tracing grant will be very impactful here in East St. Louis, but the most impactful thing that we can do right now in order to make that grant even more impactful is get tested. We're standing here at a phenomenal site here at JJK. We need to utilize the site. There's different things that have came out of this COVID-19 that allowed the city and those around us to come together as one unit and unify. You know, we were able to give out free meals with the Urban League. They'll be back June 6th. You know, but all these initiatives and all these things that are happening is a result of COVID-19 and those working together to make a better East St. Louis, a better St. Clair County and a better state. And if we could not do this without State Representative Greenwood, our State Senator, State Representative Jay Hoffman. So we appreciate those people for working tirelessly, on the behalf of East St. Louis and our citizens. So there's been a lot of people working together. Like I stated, the clergy have came together. They started an initiative, 6 feet in the street, to see what is the new norm that's going to be after the COVID-19, the new norm. So we want to make sure that everybody that has a part in this, I want to just give kudos to those people. I'll give kudos to everyone that has put their tireless effort in here, and make sure that we got to make sure that we use this tracing grant to the best of our ability so we can get back to the normality of the state of Illinois and the normality of St. Clair County and East St. Louis. So at this time, I'd like to introduce Elizabeth Patton Whiteside.
Good afternoon, everybody. As the Public Health Administrator of Eastside Health District, whose jurisdiction within St. Clair County is East St. Louis, Washington Park, Cahokia, Brookland, Centerville, and parts of Fairmont City, I have been given the monumental task of trying to contain the spread of the coronavirus within my community. And I must say, it is a monumental task. Everyone is aware that the Black and Latino adults are far more likely to experience serious illness and death from COVID-19. Underlying health conditions such as diabetes, hypertension, and obesity are some of the risk factors where I serve that community. The statistics amassed for the Eastside Health District jurisdictional area only as of today is 324 positive clients, 1,792 negative clients, 1 pending case because we haven't gotten the results for that case yet, and sadly to say, 19 deaths. Now, that might not sound like a lot to a lot of people, but for a community of our size, that's a great dent in our community. I recently addressed many reasons and myths that prevented people from my community from receiving the COVID-19 testing, and I urged them to get tested because in that article, I addressed the thing about I don't want to get tested because I see police there, or I've got warrants, I don't want anybody to follow me, or the test hurts, or anything like that. I addressed all of those myths. The test does not hurt. It's just a swab in the nose. The police, they're here for you to help with crowd control. Nobody is trying to run anybody's license plates and look anybody up, okay? Now, everyone knows to wash your hands. They know to cover your mouth, wear a mask, refrain from shaking hands, use hand sanitizer, and all of that. But we need to do a robust job of contact tracing. Now, Mark Kern said a little bit about what contact tracing is about. So I am thankful to the Illinois Department of Public Health efforts to reinforce the need for this contact tracing in our community. Contact tracing is simply investigating who a positive COVID person came in contact with for 10 minutes or more. That's all. Now, as we reach out to these individuals, we monitor them daily for 14 days for signs and symptoms of the virus while they are either in quarantine or in isolation. But that's not all that we do. Yes, we contact them daily, but we are a resource for them. We are there to help them. This is a very important and needed job within our community. We are their lifeline for continued resources for help. We are not there to blame you or create any stigmatism that goes with one knowing that you have or may have been exposed to this virus. We don't care. We're there to help you. Any help that may be it mental, physical, or emotional, we are there for you. So when we call you, if necessary, be willing, ready, and able to participate in this process of contact tracing. It is to help everybody. So thank you again to Governor Pritzker and the IDPH team, St. Clair County team, and the Health District family for having the confidence in our agency to allow us the opportunity to follow up on the positive clients and all of the contacts within our community in St. Clair County. Now I will have Governor Pritzker to come back up.
Thank you very much. Thanks so much, Elizabeth, for the fine work that you're doing to protect this community from COVID-19 and to help people who might get COVID-19. I want to remind everybody that the tests are free. And indeed, if you are COVID positive, your treatment will be free either through Medicaid or through your insurance. And we will make sure that no one is stuck with a bill for COVID-19. We really just want the people of Illinois to be safe and healthy. Before I take questions, I feel compelled today to use this platform to address what happened to George Floyd in Minneapolis and to Breonna Taylor in Kentucky, Ahmaud Arbery in Georgia, and Christian Cooper in New York City, and countless others whose memories we cannot allow time to erase. Events that echo what we have seen happen to too many people, too many times, in too many places. And yet we, as a people, have not yet found the humanity to stop these vile, horrid acts from happening, to truly contend with the racism that permeates our society, and then to root it out. As a white elected official, I feel a special responsibility to speak out today and to own the obligation that I have to shape public policy in a more equitable direction. Being black in America cannot be a death sentence, but it is. In some ways it is. And it's dangerous to pretend otherwise. We must actually do something to change that reality, to make it so that men like George Floyd are not killed on a street corner gasping for air in broad daylight, one moment alive and the next moment gone. People deserve to breathe. They deserve to live. George Floyd's family should not have woken up today in a world without him in it. This investigation requires all possible accountability and transparency to deliver the closest thing to justice here. But it will never bring George Floyd back. I'm especially saddened that amidst all the other challenges that we are facing right now, that people of color have this extra burden to bear, as they have for too long. This moment must become a call to action for Illinoisans, for Americans to see the humanity in every person, no matter their race, their religion, their socioeconomic status, or their sexual orientation. To George Floyd, to his family, may his memory be for a blessing. And with that, I'll take questions from members of the media.
So we'll be taking questions from our pool reporter and then taking questions that we received online. Microphone on the floor.
Good afternoon, Governor. Welcome back to Downstate. It's good to see you again. So first, where's Dr. Ezike today?
She was not able to join me, but she's hard at work, trust me. We've got a lot of work going on contact tracing and everything else at IDPH.
Good to know. First comes a question from my colleague Lexi Cortez at the BND. So we're hearing from readers who say that nursing home residents and their families are just devastated that they're not able to see each other because of the restrictions on visitors. What's your message to those families and residents? How do you answer questions about when they can see their loved ones again?
This is so incredibly difficult. I think you know, and the readers at BND know, that it was even before we put the stay-at-home order in place Indeed, one of the very first things that we had to do to deal with COVID-19, that we had to cut off visitors to nursing homes and long-term care facilities, because it was clear early on that one of the most vulnerable populations is our elderly. And it was in nursing homes in places like Washington State where we had already seen outbreaks that were taking people's lives too quickly, without any ability really to treat them fast enough or to rehabilitate people once they'd gotten sick. So this was something we were trying to prevent desperately in the state. We had to shut down visitors. We also started doing medical checks on every staff person on every shift so that we could try to prevent people from bringing COVID-19 in. That was in early March. I mean, that seems like years ago now, and I'm sure for family members too. As you know, we've continued that policy, and indeed we've made it even more difficult for people to enter into long-term care facilities because, you know, COVID-19 doesn't live in a facility. It comes in with somebody and then it spreads. And so the 1,200 plus long-term care facilities, nursing homes across the state, we've tried to make sure that we're on top of wherever the outbreaks are and also where there are no outbreaks to keep the people out and to make sure that we're keeping COVID-19 out. When will visiting resume? I must admit to you, the CDC is telling every state that this may be one of the last things in dealing with COVID that will happen is new visitors or visitors being able to come back into those facilities, because it is precisely from those visitors, even those who are asymptomatic, who may not think that they have COVID-19, that you get an outbreak. And so I can only tell you I'm listening to Dr. Ezike and others and the CDC when I tell you that at least for the time being, we can't allow visitors back in.
This is for me. What's the amount of the grant to St. Clair County for contact tracing? How much money?
I'll get you the number. I don't have it on me, but I mean, we've allotted, I think, a reasonable amount of money because this is not going to be a short-term endeavor. And it is going to, you know, to the mayor's credit and to Elizabeth's credit, there's going to be hiring involved here. So there are people who are looking to enter the healthcare industry where there are job opportunities. This is actually a good way to enter. You don't have to show up with any training right now. When you show up de novo, you know, as somebody who's never done this before, you get trained. It's free. The training is free. You get trained, and then you become a contact tracer, and that's the beginning, potentially, of a career path for many people.
One thing that I'd like to clarify from your statement earlier was that Illinois does not include antibody tests in its numbers statewide, but we've heard from our local health department, the St. Clair County Health Department, that they do include positive and negative antibody tests in their numbers.
So at the IDPH, when we receive our numbers from laboratories, so it's different at the local level, they'll get all of those results. When we report results, we take all the serology tests, the antibody tests, out of those numbers, and we only report those that are what are called PCR tests. Basically, it's the test to tell you whether you have COVID-19 now. The antibody test tells you whether you may have had COVID-19 in the past.
This is the last question for me, and then I'll get to the orders. A lot of pools in our area are really antsy to either have a decision one way or the other whether they can open or not. Mm-hmm. Do you have any updates on that?
In the fall, you're talking about for schools in the fall?
I'm sorry, pools.
What'd you
pools?
say? Pools.
Yeah,
oh,
swimming
pools.
pools.
Sorry, I thought you said schools.
Sorry.
It's a great question. It's not a decision that I'm going to make. Again, I've left this to the doctors, but I will say that what you ought to watch for is on the DCEO website, that's the Department of Commerce and Economic Opportunity, where we have listed all the guidance for phase 3, and then we'll continue to update that guidance and guidance for phase 4. That's where you would find when the release of information about when pools might be able to open.
This is from Monica DeSantis from WJOL Radio in Joliet. There are nursing homes that still haven't tested their residents or staff yet for COVID-19, like Our Lady of Angels in Joliet. Where are the tests, and shouldn't nursing homes be a priority for tests to protect the most vulnerable in our society?
They are a priority, and I think actually there's an article today about the challenge, right? There are more than 1,200 nursing homes in the state. If you think about the numbers of people that are represented in those nursing homes, you're talking about more than 20,000 people.
Good afternoon, and thanks everybody again for being here today. I really appreciate those of you who have listened in and been at these press briefings on a regular basis. And I also appreciate those of you who work hard to inform Missourians on the facts and to stay away from the making up of your own stories. During times like this, it is extremely important for the people of this state to be informed with the facts. Today, I would like to address a couple of questions that were brought up during yesterday's briefing. Yesterday, Dr. Williams was asked a question regarding antibody and PCR test. And then the reporter insinuated that Dr. Williams was a liar, was lying about the issue. First off, I don't appreciate anyone in the media or anyone else calling any of the directors liars. That's very unprofessional, and many of you that are in this business are much better than that to conduct yourselves in that matter. That was totally uncalled for and very unprofessional. Dr. Williams simply made a mistake answering a question at an open briefing, and since then, the mistake has been corrected. It is very difficult to stand up here almost every day like we have been doing and know the answers to every single question. We all make mistakes, including myself. There was a press release sent out on May the 23rd. Clarifying Dr. Williams' mistake days before yesterday's briefing. The release can be found on the Department of Health and Senior Services website. So I ask everyone, please take the time to read it yourselves. Yesterday, there was also a question about the potential of COVID-19 cases in February and if our administration had been transparent. An article was recently written in the Kansas City Star with the headline, "Coronavirus was in Missouri weeks before first case was announced. State data shows." This is very misleading and insinuates that we knew of other positive cases prior to the first announcement on March the 7th, which is not true. First of all, the State Public Health Lab was not approved to begin COVID-19 testing until February the 27th. From January the 22nd to February the 27th, 9 specimens from Missourians were sent to the CDC for testing, all of which were negative. The state lab began testing on February the 28th, and the first positive case was identified on March the 7th. Currently, there are about 50 people reported to have onset of symptoms prior to March the 7th, but it is not confirmed that these earlier symptoms were due to COVID-19 diagnosis that followed later. The dates on our dashboard from early in February represent the onset of symptoms, not the date when they tested positive. These cases could represent earlier cases of COVID or simply someone with a prior illness who later developed COVID-19. Many of the symptoms of COVID are very common and can have other causes, so it is very difficult to determine if cases with earlier onset of symptoms were due to COVID or a prior illness. The virus very well could have been in Missouri before March the 7th. But the bottom line is that there is no way to know for sure. The state health lab detected the first positive case in Missouri on March the 7th. Everything prior to that is pure speculation. As far as transparency, to accuse my administration of not being transparent is a downright false accusation also. My administration has worked extremely hard to be as transparent as possible throughout this process. When Missouri had its first confirmed positive case on March the 7th, we immediately had a press conference in St. Louis that same night. Since that time, we have, unprecedented, held over 50 COVID-19 briefings with over 600 media questions answered, not including additional questions answered by email. Not only have I stood up here nearly every day and provided updates, but we have brought in our state directors, doctors, and other leaders and experts from around the state to share even more information. We have sent 61 press releases with information about COVID-19 and have done approximately 40 one-on-one interviews. We created the DHS COVID-19 dashboard with specific data for the general public to view. Websites across the state agencies have also updated information for the public to easily and quickly have access to that. We have shared as much information as possible, as quickly as possible, to keep the people of this state informed and up to date. Transparency is something my administration takes very seriously. We have been as transparent as possible, not just during the COVID-19 crisis, but since the start of my administration, and we will continue to do so as we move forward. Everything we've done, we've tried to make sure the public is informed of our decisions on a daily basis. We've tried to get the most accurate information we can to share with you, the media. And for you that present that case to the public and make sure you make them aware of, I thank you for that. And I want you to keep doing those type of things because it's important people know the facts. But to try to mislead people at a serious time like this in our state when we're trying to do things that we've never seen before, it's unfortunate that people would do that. So I would appreciate us, all of us working together to make sure what our main goal is to make sure the public is informed of what's going on and what's true and what's not. They can figure out, what decisions to make if they have the right information. With that said, I'd like to share some updates on COVID-19 testing plan in place. Yesterday, our targeted sentinel testing was 2,460 tests. The actual number of tests done were 3,413. Additionally, our community sampling target yesterday was 1,100, and the actual number of tests done was 1,273. We also continue to execute the box-in testing strategy. From last week, Wednesday through Monday, we completed 2,054 tests using the box-in outbreak strategy. We are awaiting results from yesterday, and another 600 tests is the goal for today. This is encouraging news and shows that we are making progress with our plan. Like I said many times, as we continue to increase testing across the state, we must be prepared for more positive cases. But this does not mean that there has been a surge or that we are overwhelmed in our hospitals. I think it's important, again, you have to look at the information. There's going to be more and more positive cases come in. But you have to look at the healthcare numbers. How many people are in the hospitals? How many people are in the ICU? How many people are on ventilators? Those are the key as we move forward to have all that information that's out there. We continue to monitor this on a daily basis, and our hospitals, as of today, are well prepared for any upscale that we might have in the coronavirus. We're prepared for that when the day comes, and I thank them for all the work that they've done. One of the other places, under our testing plan, one of the focused areas of sentinel testing is the Missouri Veterans Home. Our veterans homes and the Missouri Veterans Commission have done a great job throughout the COVID-19 crisis, and we are thankful for their efforts to protect some of our most at-risk Missourians. Today, Acting Executive Director Richmond is here to give an update on the veterans homes that we have across the state. So, Director?
Thank you, Governor Parson. Good afternoon, everyone. Among our missions at the Missouri Veterans Commission is caring for some of our nation's heroes in our 7 veterans homes. Our MVC staff at these homes care for a total of 1,238 veterans some of whom have served our nation in every war since World War II. Our commitment to these heroes is to provide a high quality of care with compassion and dignity that they and their families deserve. For that reason, I have been very proactive in the response to the coronavirus. When the first COVID-19 case was reported in Missouri on March 7th, MVC immediately restricted all access to visitors, vendors, and volunteers for all 7 of our veterans' homes. We implemented an extensive training and infectious disease protocols recommended by the Center for Disease Control and Prevention. We welcome the sentinel testing as another proactive step to protect our veterans and our veterans' home teams. Yesterday, we began testing in our St. Louis home, and today we begin testing in our Cameron home, Cameron, Missouri. Plans are in place to test at the homes of our Mexico and Cape Girardeau locations next week. Testing for the remaining homes, our Mount Vernon, St. James, and Warrensburg homes, will occur in the coming weeks. Throughout the pandemic response, our MVC staff worked closely with the Department of Health and Senior Services, local health officials, and we look forward to continuing this coordinated effort to protect our veterans and our staff. Thank you.
Thank you, Ryan, for that update, and thanks for what you're doing for our veterans across the state. I appreciate it very much. Also, Dr. Williams is back here today to answer any questions you might have of Dr. Williams. Director Parson is also here. If you have any questions on PPE, it will also be here available for that. With our Phase 1 economic reopening order expiring on Sunday, we know there will be a lot of questions about what is next. Tomorrow, we will be addressing the order and the next steps for Missouri. We are pleased with how well things have gone so far, and we are still hopeful for the future. However, we must continue to be diligent and proactive in our efforts. As long as we continue to be smart and protect ourselves and those around us, we will continue to have the progress, we will continue the progress we have made. Thank you, and be sure to listen in tomorrow for more on the order. Thank you very much, and God bless. Kelly, questions? Yep.
Director Richard?
Yes.
Hey, are you testing, and I may have missed this, are you testing both employees and residents?
Yes, we are testing both employees and residents.
Okay,
yes.
thank you.
And I was just going to ask the same, just kind of how, what exactly will this testing look like in these homes, like as you start moving forward towards like Mexico, Missouri, and things like that? Like what exactly could veterans expect there?
We'll follow the medical process that is in place or has been put in place with our internal staff there in the homes. We have plenty of medical staff there to handle the testing.
All right, thank you.
Thank you. 2 updates very quickly. As the governor said, we are in the middle of doing our long-term care facility boxed-in strategy. As I told you last week, we had about 51, and we're about halfway through those 51. In addition, we've had 10 more come forward with our new case definition of 1 staff member or 1 resident, and we are in the middle. All 10 of those are part of our boxed-in strategy as well. So that is ongoing, and then we will start our community prevalence sampling is upcoming as well. So again, as the governor said, you're going to see a lot of numbers, and we expect that you'll see some more positives. Just to show you how complex testing can be, there's a new test, antigen testing, and that's now come out. And so I was in conversations today. So we have PCR, we have antibody, and now it's come to our attention we have antigen testing in Missouri, which is a nasal swab that detects the antigen as a point-of-care test. So we're in the process of developing a reporting system for that, which will be separate and distinct than the other two because they're different things. And then the other thing, just to keep you posted, is contact tracing. That's something that's very important to us, and we have been meeting about that all day today, and we'll roll out a plan next week to give you a little bit of a hint of what we think that'll look like. We're still in the process of looking at best practices all around the country. But that will probably be a hybrid model, working with our local health departments who end up doing much of the boots on the ground work for that. And working with them, if they need more capacity, then we'll try to provide that through the state. If they would rather do that themselves, then we'll try to make that work for them as well. So I think that will come out mid next week. So with that, I'd be happy to answer any questions. Thank you.
Good afternoon, Dr. Williams. Yes. Can you talk a little bit more about the community testing that's been taking place this week, and what happens if someone tests positive? Is the state involved with notifying them or advising them what to do after that?
Well, as always, the locals have been a great partner, so we do it in conjunction with the local health directors, and so they notify the positives, and then they institute the contact tracing. You may remember in our first batch of 3,000, we only had 9 positive. And so we are now proceeding with 6 more counties, but very much on a regional approach. We very much encourage people to be tested and have been very impressed with how much they appreciate that opportunity. So it's really the locals who we work with on that.
We have seen a doubling of the number of nursing homes that are reporting. Can you give an analysis of that? And does it make you reconsider your earlier decision to not release the names of the facilities?
Yeah, I read your article, Kurt. I thought it was a good article. And again, legally, we're not allowed to to release the names of the facilities. The locals can. And some of them have chosen to, and some of them have not chosen to. But for us, it's not a choice. I've vetted that with our lawyers, and because of the way it's reported up, we're not allowed to report that. As you know, CMS has now, again, you cover it in your article, has changed their requirements, and so people are notified, and then the locals, we defer to them on